Well, hello, everyone. Thank you so much for inviting me to come and all of us to come. And as Dr. Kingsburg said, decreased desire really does distress women. And I'm here to tell you a little bit about my world. I run a sexual medicine clinic in Philadelphia. We see 200 women a week. That's 10,000 a year. Those are all not new patients. Some of them are revisits. But I want you to know that the need is so great that a third of our patients come from the Delaware Valley, which is the Philadelphia, New Jersey corridor. But a third of our women come from as far as New York and down to Virginia. And then another third of our women come outside of that corridor. They fly in from California. They've come from South America. They've come from London. Women want accessible health care that focuses on their sexual needs. I'll tell you a little bit more in a few minutes. I just want to quote a few studies, however. This particular study is brand new. This was done by a colleague of mine named Ray Rosen and colleagues, and he looked at the characteristics of low desire in women. Who are women with low desire? Well, 80% of them are actually in a partnered relationship. 63%, or actually 64% actually, are premenopausal, and that may surprise you a little bit because most people think, well, women with low desire, they must be in their older years. Well, not so. A large percentage are premenopausal. Many of them have another sexual problem. Perhaps they're having difficulty with arousal, orgasm, or pain. And I will tell you that it's very compelling in my clinic to see women who have horrible, searing pain every time they try to be intimate with their partner. Their skin may, I don't want to be too graphic, but their skin may rip and bleed. It may be really erythematous and red, and they just develop such an aversion to being intimate when they hurt so very badly. Many of them are depressed. About 45% are depressed, and actually about almost 40% are dissatisfied with their sexual life. Interestingly, only about a third have actually sought formal care for this. And that is because, for a number of reasons, perhaps as Dr. Kingsburg said, they're embarrassed to bring it up with their healthcare provider. But as you're going to hear in a few moments, some of them are very brave and they bring it up with their healthcare provider only to be rebuked by that healthcare provider and told to go home and have a little wine and just relax. Yeah, right. Okay. Anyway, many of them are taking antihypertensives and cholesterol-lowering medications. Some have arthritis. Many have children, et cetera, et cetera. The PRESIDE study did show that about 10% of all women, and this is a very, very large United States representable sample, about 10% of women had desire disorders, 5% arousal, and only about 5% have orgasm disorders. But let me tell you, if you have one of those, you have low general happiness, you don't feel like you're a whole woman, and you don't really feel, a lot of the patients say to me, Dr. Kellogg, I think I'm broken. That's pretty dramatic. And then another study I'd like to quote, and this was also a brand new study that looked at almost 1,200 women, and it was a reanalysis of a previous study that looked, at postmenopausal women with sexual disorders, and it found that they had statistically significant decrease if they had a sexual disorder, a decrease in their vitality and their social functioning and in their overall mental health than age-matched women who did not have a sexual complaint. There's one more study I want to tell you about that was fascinating to me that I was involved in this year. It was a nationally representative sample of 1,200 premenopausal women. And we actually asked women to rate in priority or in importance how important was their sexual life to them. And they said that their sexual life was more important than career advancement, travel, and their overall social life. Career advancement. I mean, today's women are very into their career, but they would trade all of that, they said, for a satisfying and normal sexual life. In conclusion, sexual dysfunction affects more women than men in the United States, and about 1 in 10 women have low desire. Decreased sexual desire causes negative effects for women, including mood instability and depression. And despite being a very common condition, communication between women and their healthcare providers and women and their partners about their desire and other sexual concerns, it's lacking, and we need to do something about it. I'd like to close by reading to you 2 letters. Paul mentioned a few minutes ago that I was privileged enough to have my clinic featured in the New York Times last Sunday. And as a result of that feature article, the reporter that wrote the article received 2 letters almost immediately. As soon as these women read the Times, they hopped on email and sent him the letters, and then he sent them to me. And I thought you should hear from the women themselves, not just from me. Excuse me. Many thanks for this fantastic article. You are really making a difference in people's lives through your reporting, Mr. Weinrip. That was the name of the reporter. Through sexual frustrations, my husband and I have lost intimacy, and recently I learned he is now seeing someone new and has requested a divorce from me. I'm only 31 years old, and I wished I had had someone with whom I could consult regarding my sexual health. Although I cannot thank you enough for this important article educating readers on sexual health focused on women. For so long, society has only focused on pleasing men. But what are they to do when women cannot be pleased themselves? And the second one says, I'm about to turn 55 and I stopped taking antidepressants and anti-anxiety medications a year ago for a variety of reasons. Ignorantly, I believed my sex drive would return. I decided to speak with my 7-year-old OBGYN about my lack of sex drive, and during my consultation, I wanted to talk about bioidentical hormones, a decision based on the aforementioned lack of sex drive. The hormones have helped my hot flashes, but still no real drive to speak of. I'm thanking you for one main reason, Mr. Weinrip. My husband now knows that I'm not lying when I say to him that my doctor was unwilling to discuss my lack of sexual desire. I was humiliated, frustrated, and shocked by his attitude when I brought it up. I have my annual exam coming up, and I don't want to go back to that man again. I'm going to begin a search for a new OBGYN today. My husband actually brought me your article in the New York Times to read, and the look on his face is one I have never seen ever before when we have been discussing our strained sexual relations. He said, you've got to read this. It confirms what you've told me. We've been married 15 years, and I'm afraid he was about to give up on me in this department. Not surprisingly either, I had given up on myself. Thank you for helping us with your article and for raising the issue for other women. Thank you.